In today's world, it's more important than ever to be in control of your healthcare choices. So take an active role in making the right coverage decisions for your personal situation. Making good decisions about your care, from choosing the coverage that meets your healthcare needs to requesting generic prescription drugs, is essential to getting the most out of every healthcare dollar you spend. With 3 different medical plan options, you choose what is best for you and your family. Regardless of which plan you choose, you can rest assured that you will receive the following: a national network, so you can locate a provider or facility in any of the 50 states. No primary care physician referrals required. Simply choose a provider within the network for benefits at the in-network level. The same copay for primary care physician and specialist visits across all 3 plans for in-network providers. Electronic tools available 24 hours a day, 7 days a week at www.myuhc.com, including provider lookup, Quicken Health Expense Tracker, a healthcare cost estimator, online nurse chats, and much more. 100% coverage for well child and well adult visits when provided by in-network practitioners. Obstetrician and gynecologists are considered primary care physicians, so when seeking services in participating OB/GYN offices, you are only subject to your regular copay. And finally, member discounts for acupuncture, alternative medicine, massage therapy, cosmetic dentistry, laser vision correction, hearing services, weight loss programs, fitness clubs, exercise equipment, nutritional supplements, and much more. Now that you know what services are the same between all plans, let's talk about the differences in each plan. The Choice Plus Basic Plan gives you freedom of choice for your healthcare needs. You have the ability to use providers from UHC's national network or go to a provider outside of UHC's network. After meeting an annual deductible of $850 per individual or $1,700 per family, most services are covered with either a copayment or coinsurance. You will pay more for services received out of network. In-network copayments for most services are $25 or $50 for specialty care. For most out-of-network services, you are responsible for 40% of UHC's allowable charge, plus any additional costs that the provider charges above the UHC allowed charges. The Choice Plus Medium Plan is similar to the Basic Plan in that it allows you to go both in and out of network. However, under the Medium Plan, you pay more for your monthly contributions, the money that comes out of your paycheck, but are responsible for a lower annual deductible, $500 per individual or $1,000 per family, if you are going in network. This is compared to $850 per individual or $1,700 per family for the Basic Plan. In addition, the Medium Plan provides coverage for in-network infertility benefits, up to $30,000 lifetime medical benefit and up to $8,000 pharmacy benefit, obesity surgery, up to $60,000 lifetime limit, and hearing aids for adults and children. These services are not covered under the Basic Plan. The Choice Premium In-Network Only Plan is an HMO-like medical plan that covers in-network services only. Non-emergency services rendered outside of the network are not covered. However, true emergency services are always covered in full. Monthly contributions are higher for the premium plan, however, there is no deductible. To access care, you simply select an in-network provider. There is no need to designate a primary care physician or obtain a referral like other HMO plans. It's as simple as visiting a practitioner from UHC's vast network and, for most services, paying your office copay. Remember, you have access to a national network. There are UHC providers from coast to coast. The premium plan also includes coverage for infertility benefits, obesity surgery, and hearing aids for adults and children, similar to the medium plan. Now that we have explained some of the differences in the three plans, let's look at some of the key decision points you should consider when deciding which plan is right for you. Do you want a plan that allows you to see providers beyond the UHC network? If the answer is yes, the premium plan is probably not the right plan for you, as this plan provides coverage only for in-network providers, except in the case of emergency. If you want the ability to go to both in and out of network providers, the basic or medium plan are likely a better fit. Do you need coverage for service such as infertility, obesity surgery, or hearing aids? If you said yes, you may be better suited for the medium or premium plan. Both of these plans provide coverage for these types of services. You will not receive coverage for these services if you elect the basic plan. Are you more comfortable paying higher monthly contributions out of your paycheck to avoid possible higher costs when you receive care? The answer to this question is different for every person. Some individuals prefer to pay a steady, higher amount out of their paycheck to avoid the risk of higher medical bills. Others prefer to pay less each month and are willing to pay more at the time of service if needed. Under the premium plan, you will pay the highest in monthly contributions, but in most cases will only be responsible for a small copay when receiving services. You also do not have to meet a deductible under the premium plan. Under the basic plan, you will pay the lowest amount in monthly contributions, but for services beyond regular preventive care and in-network office visits, you will pay more at the point of care. You also need to meet an $850 annual deductible, or $1,700 for family, under the basic plan. However, it is important to note that you do not need to meet the annual deductible when receiving preventive care services, such as your annual wellness exam. Preventive services, in most cases, are immediately covered at 100%. The medium plan falls somewhere in the middle and requires higher monthly contributions than the basic plan, but lower costs at the point of service, and a lower deductible than the basic plan. Remember, preventive services, including well adult and well child exams, as well as certain age-appropriate exams, are always covered at 100% regardless of the plan you choose, as long as the service is provided by an in-network provider. Choosing your medical plan is an important decision that requires careful thought and consideration of your own personal health situation. To further support you in making this important decision, GW provides you and your family members free confidential access to a personal health advocate, a healthcare and benefits expert who will help you assess what plan might be best fit for your individual needs. You can contact Health Advocate 24 hours a day, 7 days a week at 866-695-8622. We hope that you found this brief overview of our three benefits plans useful. If you have general questions regarding your benefits, please call our Benefits Call Center at 888-449-8326 or visit GW's Benefits Administration Department online at benefits.gwu.edu.